Well, here in France and in much of Europe, many of us will be getting an hour less sleep tonight. Clocks spring forward 1 hour on Sunday, marking the start of daylight savings time. If you live in the US or Canada, you already moved your clocks forward earlier this month. And if you live in South America, Africa, or Asia, you probably don't have to change your clocks at all. The general idea behind daylight savings time is to give us more evening light during the summer and more morning light during the winter. But there is a movement to abolish the switch, with some saying that it's bad for health. Well, to discuss the pros and cons, we can cross to Rouen, France, and speak to Dr. Jan Cédric HANSEN. He's the Vice President of the Global Health Security Alliance. Thank you so much for coming on the program. Let's start with the negative argument, perhaps. In what ways is this time change bad for our health?
Well, there is little sound and relevant studies that back up any claim of being good or bad for human health. But what is quite clear is that there is a social impact of the DST, the daylight saving time, because it actually diminishes in the summer, as you just said, it diminishes the time of daylight before noon, and it increases the daylight afternoon. And from that, there is a social jet lag of our habits, and therefore we are going to sleep much later, and therefore it does, and this is well documented as the opposite, that we have a very bad quality of sleep, and the quality of sleep does impact our working day life or security during the daylight and working life. For example, there is a well-known direct link between the quality of life and the number of traffic incidents or accidents, as well as in work or in the social habits. So having a good sleep hygiene is something very critical for the human species, and most of it in the Europe and in Africa and in North America, indeed.
And are there any positive impacts that we get in exchange for perhaps the sleep that we're losing? Maybe there are mental health benefits to spending more time outside, or people are exercising more.
Well, there's no specific studies weighting the pros and cons regarding the loss of sleep, because we know that loss of sleep will increase anxiety and depression. For example, it will increase your blood pressure, increase your vulnerability towards diabetes or any cardiovascular threats. And there is very little studies on how it increases, how your social life experience is increased positively regarding having more time in the evening. But what is interesting in your question is that the original goal of the daylight saving time was to diminish the consumption of energy regarding the use of lighting of households or industry or offices. And nowadays, there's so many ways to spare energy that we can ask ourselves, is it still relevant to have such a measure for that? But again, there is no real sound studies that may tell us whether this measure is relevant from the economic or the health aspects of the original intention.
Yeah, as you say, not a lot of evidence to go by, but if you had to decide, do you think we should abolish, changing hours? And if we're going to stick with one time, should it be the standard time that we use in the winter, or should it be the daylight savings time that we use in the summer?
Well, I think that's a social decision, so it belongs more to politics than to healthcare experts to that. We can deliver some elements, some arguments with pros and cons topics regarding that question, but it's difficult for us. One thing that is clear, and Canadians have particularly and recently highlighted, that it should be, if we were to choose and to keep the daylight saving time, we should more synchronize it on equinox rather than doing it the way we do today, and to do it more on Friday, because it will give us 2 additional days, rather not Saturday and Sundays, to adapt to the new schedule. So for our own health, that would be positive impacts.
All right, Jan Cédric HANSEN, thank you so much for joining us. Again, that's Dr. Jan